Hello, my friends. I'm here with Dr. Michelle Dossett, who's a friend of mine, recently returned to the West Coast. And as California snobs, we say recently returned, upgraded to the West Coast from the East Coast. Hello, Michelle.
Hello, Asha. Try to be with you today.
Yes, Michelle, you're speaking to us from.
I'm speaking to us from Sacramento. I'm actually in my office at UC Davis Med Center.
And you're living now in the Sacramento community, correct?
Correct.
This is the first time you've been able to live in community. Is that right? Or did you live in Seattle community for a time?
First time I've been able to live in community. Yeah, in Seattle, I was not in the community.
Oh, very nice for you. Okay, well, since we're starting at UC Davis, we'll start with the present, and then we'll go back to the past.
Okay.
So what are you doing at UC Davis?
I'm an internal medicine physician here. I spend about 25% of my time seeing patients with the residents in the primary care clinic and a few weeks a year in the hospital. And then 75% of my time is devoted to research. I have a grant from NIH studying doctor-patient interactions and trying to understand the mechanisms by which augmented interactions actually leads to better health outcomes for patients.
And what's your basic theory of what are you trying to prove or disprove?
Well, what I'm looking at is measuring heart rate variability and galvanic skin response. These are two different sort of physiologic measures in the doctor and the patient while they are talking to each other. And the hypothesis is that increased physiologic synchrony in the dyad is associated with better outcomes for the patient.
Now, let's try that one more time in English, if you could.
So heart rate variability is a beat-to-beat variation in your heart rate. And galvanic skin response is a measure of the amount of skin conduct, the degree of conductivity that your skin has. So when we are anxious or more emotionally aroused, our skin is more conductive. We sweat a little bit more. And there is some data in the client therapist literature and also in other studies of dyads like spouses or parents and children that changes in these parameters that occur in sync so that they're going up and down together is associated with greater empathy or greater connection between the individuals. So I'm using these physiologic markers as ways to look at connection in the doctor and patient. And if there are certain kinds of questions or certain behaviors that the doctor does that elicit greater connection between the two, and then somehow mediates the patient getting better because they perceive the doctor as being more caring, or that they reflect on their symptoms and perceive them in a different way.
Oh, very interesting. Now, before you came back to California, when you were on the East Coast, you were doing research. Was it related to meditation, or was it? Tell me how meditation played into what you were doing there.
Yeah, so I was at the Benson Henry Institute for Mind-Body Medicine at Massachusetts General Hospital, and I had this grant doing the research I'm doing now. But because I was at the Mind-Body Institute, I was also doing meditation research, and so they have an 8-week program called the Stress Management and Resiliency Training Program that includes training and meditation as well as some other tools. And we looked at that program in physicians and nurse practitioners as a way of helping them decrease stress related to their jobs, and found that it was very helpful for that. We also looked at that program in patients with paroxysmal atrial fibrillation, a kind of heart arrhythmia, and found that it improved quality of life and reduced stress for those individuals.
So you managed, go ahead.
And I'm in the process of writing grants so that I can continue doing more of that work while I'm here at UC Davis.
That's a very good idea. So we're at the end of the story where you've managed to put together some of your spiritual interests with your professional interests. Why don't we back up in the story a little bit?
Okay.
We can go all the way back to before you met Master. What were you doing with your life before you became a disciple? Where did you grow up? How did you grow up?
Yeah, great question. I grew up in St. Louis, Missouri, in the middle of the country. I was actually born in Seattle, but grew up in St. Louis. My parents moved there when I was 5. Um, and uh, my parents were seekers themselves. I was very fortunate in that regard. My dad had books on Buddhism and mystic Christianity and Judaism and Hinduism on his library shelf. And probably around junior high, high school, I started getting really interested in those things and started reading books from his library shelf. I remember getting very into the Tao Te Ching, and my dad and I were comparing 3 different translations of it, and just being very curious about the nuances. A little bit, sort of in my head about it, but that was my connection to it at the time. And reading spiritual autobiographies. So I first read the Autobiography of a Yogi when I was in high school. Um, it planted a seed. I thought, this is a great book, but I don't remember a whole lot else other than that. I took my first Tai Chi class with my dad when I was a senior in high school, and my parents actually taught me meditation when I was in high school. I was really stressed out. I was taking all honors classes, and I actually had pain in my right forearm from gripping my pen and trying to scribble notes furiously in class. And again, it planted a seed, but it didn't really sprout right then. I then did my first year. Oh, and there was one other seed that got sprouted then. My dad was invited to give a talk in Seattle one summer at a spiritual summer school, and I went with him, just sort of tagged along. And there was a student who was a teacher of the main teacher who was running the summer school, who at the end of the week came up to me and gave me this sort of folded up poster and said, "Shh, don't tell anyone I'm giving this to you, but I think you'll really like these."
Really?
They were a poster of the energization exercises.
No kidding. Huh.
And I took it, I looked at it, I didn't know anything about it, and it sat in my dresser drawer for years.
I guess the secrecy was probably from SRF, and they weren't supposed to pass it out unless you had joined SRF or something like that.
Actually, it was Ananda's poster.
It was an Ananda's poster.
It was Ananda's poster, and maybe the secrecy is because this group wasn't connected with Ananda in Seattle, and so he didn't want the main teacher to know. I don't know,
I got
but
it.
But it was
promoting. He was promoting the competition.
So that's that. Those were sort of the seeds that got planted. When I was in college, I started meditating, mostly because of my own sort of spiritual yearnings and questionings. And
what form did that take? Was it what meaning of life, a devotion to God? What were you thinking?
It was. I think there was a little bit of devotion to God there, but I was so in my head and so intellectual. It certainly didn't have the form that it has now. But I think a lot of it was just sort of trying to understand, what is my purpose here this lifetime? What am I supposed to be doing? And wanting to grow spiritually and to know God, but not knowing how to go about doing that.
That's pretty fair.
Yeah.
So you started meditating in college?
I started meditating in college. My parents moved back to Seattle from St. Louis after my first year of college, so I moved with them and I transferred to the University of Washington. And when we first moved back, we were attending a church with this woman who was a Christian mystic who my parents had known for many years. And so I took classes and, meditated with that group. And then for various reasons, we sort of had to leave and move on, and um, went and was part of a meditation group that met on Orcas Island once a month.
Mhm.
And so I would drive up there, and interestingly, the couple who ran that group also had a connection with Master.
Mhm.
To the best of my knowledge, they were not part of SRF and they were not part of Ananda.
Mhm.
They had been at one time, but they were very inspired by Master. And so it was like he kept showing up in my life.
Uh-huh.
And then they stopped running that group, and I didn't have anything for a period of a few years. I was aware of Ananda in Seattle, and in fact, my parents had started going to Ananda in Seattle eventually. Um, and I would go for holiday services to support them and to be with the family. Um, but I had gotten a little bit um, turned off by small spiritual groups.
That's a very specific aversion, small spiritual groups.
Well, I had had some experiences that had made me a little wary,
Yeah.
and but I also realized like I was getting nowhere on my own. The quality of my meditation practice was really deteriorating, and it was really just me sitting every day and my mind just doing this,
Uh-huh.
you know, and going all over the place. And I missed the satsang.
Uh-huh.
Um, and at a certain point, I realized going to the Sunday service at Ananda with my parents how um, how touched I was by the music. Music had always, despite my being, very much in my head, music has always been important in my life. I played piano and violin growing up. And so Master's chants, Swami's songs were able to touch me in a way that maybe the intellect wasn't quite open to yet. And I was also just really impressed by how genuine everyone was. They weren't there trying to force anything down your throat. It's sort of like, this is what we do. If you're interested, we're happy to share. If not, that's fine. It was totally unaffected and so honest and genuine and present. And so I took a class, I took Raja Yoga. I was like, wow, these tools like really work. My meditations are getting better. And I just kept going and eventually became a Kriyaban and
Yeah.
got invited to learn the harmonium, to start playing for kirtans and chants, and as they say, the rest is history.
So were you still in college when this happened, or had you
No,
finished?
this was in med school when this happened. So I did a combined MD PhD.
Uh-huh.
So I did the first 2 years of med school, then I was in the lab for 5 years doing my PhD, and then I went back and did the last 2 years of med school. So it was while I was
You
in
really
doing my PhD.
you really like education, don't you?
Just tell people I'm a slow learner.
Okay. Sure, if it works.
But that was part of my master plan, which was to get the credentials so that I could do research in integrative medicine
Huh.
and show to the um, conventional medical establishment how it works.
Uh-huh. Very interesting.
That was the rationale way back then.
Huh? Huh.
And so it was during my PhD actually that I started going to Ananda more regularly, took Raja Yoga, became a disciple, and all of that.
All of that. How did things change when did things change when you became a disciple?
Not right away, no.
Uh-huh.
And I'll be honest, when I became a disciple, I didn't know for sure if Master was my guru,
Uh-huh.
but uh, I believed that he was a true guru, and I believed his statement that if he wasn't my guru, he would lead me to whoever my guru was. And that was good enough for me
Yeah,
at
that's
the time.
good enough. That's very good. Did
Yeah.
you meet Swami Kriyananda anywhere in that process?
Um, yes, a couple times he came up to Seattle and spoke.
Uh-huh.
So I heard him speak. I didn't have a chance to meet with him one on one.
Uh-huh.
I think maybe I'm remembering an event at a hotel, maybe where he was blessing people, and I think I was blessed.
Do you have any, did he make an impression on you or not particularly at that time?
Um, he struck me as a very deep and wise teacher. I did not at that time appreciate his spiritual stature as I've come to over the years.
How did your impression shift? Why did your
Um,
impression shift? How or why?
I can't say it was any one specific thing,
Mm-hmm.
but reading his writings more and also sort of witnessing from a distance
Mm-hmm.
events towards the end of his life
Mm-hmm.
and how he carried himself and what I heard others say and just the he was so blissful at the end of his life, you know? And I think I've grown as well too, so that when I, sort of first started, I couldn't see that or appreciate that as much.
Yeah, that's a very true thing. Was there any line in the sand when you felt that you shifted, or was it just you sort of woke up one day and realized the ice cube had melted?
It was more the latter.
The ice cube
I
just
think it was
melted.
a gradual thing.
Yeah, and then the puddle dries and something is different, and you didn't know. After you finish your PhD, is that when you moved to the East Coast?
No, no, then I went back to med school for 2 years.
Right, of course.
And uh, it was around that time that I started. I was already practicing Kriya Yoga, but it was around that time that I started chanting more. Um, and invariably, Padma, who is one of the spiritual directors of Ananda Seattle, would ask me if I could chant for lead chants for, it'd be a special event that they would be having. And invariably it'd be like the night before a final exam for one of my clinical rotations, or like the day before I was leaving for town for a 6-week rotation in another state, or the day after I was getting back. And I always said yes,
Uh-huh.
and it always worked out. It was just the strangest thing. Like, but it was a really good lesson for me early on in the path in terms of saying yes and putting my spiritual life sort of first, and then trusting that Divine Mother was going to help me with the medical school stuff.
Well, that's very, very good. So you would say the impact of being a disciple on medical school was, would you put it like that? Or how did it change your relationship to medical school?
Well, I mean, I will say not just medical school, but meditation and my spiritual life is what's gotten me through my medical training,
Hmm.
particularly residency. I can't imagine having gone through that experience without being on this path and having the spiritual support from uh, fellow guru bhais, um, as well as just tools that I could personally use to try to stay calm and centered amidst the craziness of all of that.
Hmm. Very good. So, in a certain sense, you owe your medical degree to Masseter,
Yeah.
just like Sri Teshwar got Master his college degree.
Right.
Master got you your MD.
Master got me my MD and my medical license.
Both of them. I'm very glad to hear that. You have continued seriously pursuing your medical career as you planned it,
Yes.
before you became a disciple. So you don't see, you see that one serves the other, or, I mean, how do they work together in another sense? I mean,
Well, I see my work as my way of serving
hmm
Divine Mother in this world.
hmm
Uh, both my clinical work seeing patients,
hmm
trying to help alleviate suffering and teach tools that people can use to improve their lives.
hmm
Um, and my research in trying to change the culture of medicine for the better.
hmm so you're a secret agent for Divine Mother planted on the inside. That's very good. Are you taken seriously? I mean, your meditation work on the East Coast and um,
Yes.
uh-huh.
Yeah.
Do you find there's a culture within the established medical world that's open to this other way of looking at things?
Yes. And increasingly more so.
Mm-hmm.
Uh, 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 it's definitely more open now than it was 10 years ago.
Mm-hmm. That's a very good sign.
Yeah.
Yeah.
Yeah. And I have a handful of colleagues here at UC Davis who are also meditators.
Uh-huh.
Um, and that's who are in other medical specialties, and so to have colleagues that we can talk about this stuff and talk about doing research projects and meditation together is wonderful.
So is meditation the key? I don't know what the word is, alternative or supplementary issue that you're trying to bring into the medical world? Because you talked about alternative. There's lots of that means lots of
Yeah,
different things.
yeah. So I'm board certified in integrative medicine, which is a broad sphere of other modalities aside that are typically not part of conventional training.
Uh-huh,
Uh, but within integrative medicine, I would say mind body medicine, meditation, and related tools
uh-huh.
like that are sort of my main focus.
Do you find that doctors themselves are eager to learn to meditate because of the stress and the responsibility? Is there interest in meditation among the physicians?
Yes and no.
Yes and no. Okay.
So I'm hosting a 15-minute Zoom session every Wednesday morning and have been for the last almost 3 months now with COVID. And, you know, sometimes I get one or two people who come. Last couple of weeks, nobody.
I see. So,
Uh, you know, physicians are very busy,
uh-huh,
and uh, it's hard for them to make it a priority unless it's already part of their lives.
I see. Interesting. Very interesting. One would think, with often life and death responsibility and dealing with so many really metaphysical issues, but nonetheless not so. Huh? I was very impressed. This was it's a physician in India, not in America, but he's a heart surgeon, and he's a heart surgeon. Whatever his specialty is, it's like when there is no other option, they
Mm,
come to him. And he
mhm,
said to me very interesting, like after I mean, in India there's more of a spiritual orientation in general, but after we got on our path, he realized, he said, and he was already experiencing it, but it wasn't clear to him until he got on our path, that his job, as much to help people get well, is to help people to die.
mm.
But it wasn't until he got the tools of our path that he really understood how to do the second part of that.
Yeah.
Yeah, I would, but I guess that's just me. That would drive me to a spiritual approach, but it may just drive doctors to drink. I don't really know what it drives.
Well, people have a lot of coping tools, and some of them are healthy, and some of them are less healthy,
Yeah,
right?
yeah,
You know, so I think there's interest, but uh, it's competing with a lot of other things.
right. But you're still, if when you think forward in your life, being a disciple and being a doctor, what does the future look like to you? I mean, for yourself, I mean, how do you see yourself?
Yeah. So, I consider myself very fortunate that my personal and professional lives have been able to overlap so much,
Mhm,
and that I have work that is meaningful and serviceful. And,
mhm,
um, looking forward, I see myself doing more in the sphere of research.
mhm.
UC Davis is actually planning to open an integrative medicine clinic next year. And so my goal is to move my clinical activities over to that clinic,
Uh-huh.
so that I can really move more into that area, which is where my heart is clinically.
Yeah.
And then, I live and serve in the Sacramento community. So, helping out with Sunday services and classes and,
Mhm.
being of service there. And I just think all of that's going to continue to expand. And
I mentioned at the beginning here, because I've known you for a long time, that this is the first time you've been actually able to live in community, that career and life and community and geography have all fit together. How has that changed things for you?
it's wonderful. It's I feel sort of a level of support
Uh-huh.
in my personal life that I've not felt before. Um, it's made it easier to connect with people about spiritual things. Um, and I say that having come from being on the East Coast for the last 11 years, where, I'd have to drive 40 minutes to an hour and 20 minutes for satsang.
Uh-huh.
So
Yeah.
to be able to walk from my apartment 5 minutes to the church,
Uh-huh.
could walk to church,
Uh-huh. Yeah.
is just really a blessing. Um, but life still has a way to creep in, and so you really sort of have to defend those edges and say, no, this is my time for God, uh, and make that a priority. But it's really been wonderful to have it all come together.
Well, I'm very happy for you. Certainly, full disclosure, I was certainly doing everything I could to push you off the East Coast and get you to the West Coast. I don't take
For
credit
which I'm grateful. I needed some pushing.
but I can certainly see that. Well, Michelle, very, very nice to talk to you and just wonderful to see it all going well. And it's very nice to have allies inside the medical profession who are really bringing these worlds together.
Yeah.
Uh, each of us is born for a particular work, and it certainly seems like Master made sure that you were well trained on this one, so you could do your part. All right, sister.
Thank you.
God
Thank you for
bless
that,
you.
Tasha.
What a
And
joy to
blessings.
see you.